Now, like a dog or an animal, it has some significance. That's why I put this in this slide, first slide. I saw in the art magazine some 10 years back. I bought that magazine for 500 rupees for this single picture. It is a woman, this is a sculpture in fiberglass. But it is so realistic. Now, when you read embryology, you will come across a word, the milk line. The milk line now, in this milk line, during embryogenesis, multiple means it might be 2 or 3 small primitive breasts are there. It's like this. Now, out of when the organism or the fetus is increased, it is growing up in the first trimester, second trimester, third trimester. The milk line, there are small breasts. That's why in males even there is a milk line and there are 2 breasts here, and there may be just a black spot with a small nipple. It is a remnant. It is not fully developed breast. Similarly, in women, you can find in the axilla, the breast proper, even below. Now, it might not manifest as you grow up. Then, when the lady becomes pregnant, then both lactating breasts are there, and also a painful swelling is in the armpit or in this line. So, during all these years, there was no complaint of any swelling. But after she becomes pregnant, this dormant tissues becomes active. It is not a normal phenomenon, but it may happen. Normally what you see, just 2 breasts, আমাদের কল্পনাতেও আছে সেটা, we are getting the imagery of 2 breasts, but it can happen. But it is not that it will be like this. At least I have not encountered. But I have encountered in the male and also in the armpit. So it is best time when the lady complains, you do an USG to confirm, and also you do a fine needle aspiration cytology, and accordingly you have to manage. You can, because she will be having pain, but immediately during the first 3 months you don't go for surgery, you give some painkillers, palliative treatment, and you will get it. She must be in comfort zone. So, now, this is the adult female breast of the right side and the mammary bed. Now you see the clavicle, the pectoris major muscle. This is the mammary gland. This is the areola. This is the nipple. This is the foramen of Langer. This is the axillary tail of Spence. And you can see the digitations of the serratus anterior muscle. Now you will be doing thorax. So the serratus anterior muscles you will be seeing dissecting and view it in the atlas. Now, anterior view of adult female breast. The non-pregnant inactive ductal system. During pregnancy, alveoli proliferate at the ends of the ducts. These alveoli proliferate. But if there is some hormonal imbalance, then any lady you are seeing, she comes with a swelling or some complaint in the breast, non-pregnant lady, or marriage is not necessary for a lady to become pregnant. So you do a routine test of urine and also the hormonal profile. What we usually do is, with a routine thyroid test, thyroid profile, we do a prolactin. Now, the prolactin level is high, and you ask that when you press your breast or nipple, does it milk drops out? Or a girl, adolescent girl, she may come to you with a complaint of lactation. It can be either way. But your thinking, তুমি ছেড়ে দিলে ওটা ঠিক আছে ওটা হবে এরকম. No, you have to scrutiny. You have to ask, and then you just ask for a menstrual period. That's natural. You can ask, and you're bound to ask with the mind that she can be pregnant. Because আমরা কি করি, my 42 experience is practicing in the rural area, or it can be South City, your South Calcutta, any lady, আমরা আমার কন্যা প্রেগনেন্ট হয়েছে, এটা আমরা সবাইকে সমাজে বলতে চাই না. Say encounter, it can be the result of encounter. Now, so you do this test for any breast lactating adolescent to this thing. And also see, after just post delivery, suddenly if it's a girl, then the breast swells up. Not in all cases, due to some hormonal changes and imbalance, and also there is the mother complains that দেখুন ডাক্তার বাবু, showing there's a কিরকম রক্ত, মেন্সের মতো রক্ত বেরোচ্ছে. This you have to widen your spectrum of thinking. Now, so now arterial supply of the mammary gland. Now, this is the internal thoracic artery supplying this portion of the breast, superior thoracic artery and lateral thoracic artery. This is supplying the breast. So you can go for a breast surgery without anesthesia, means local anesthesia you can perform. You see, locate the arteries, you can tie up, you want to do simple mastectomy or simple lumpectomy. Only you remove the breast. This is the significance of learning anatomy. If I have a chance, I will show you a video, not today, that local anesthesia you can perform many surgeries. But at present, you must get an anesthetic help and do it under anesthesia. But small tumors, small fibroadenomas, small one lymph node in the axilla, a lipoma, that can be removed under local anesthesia. But you have to do a bit counseling. যেমন আমি হয়তো কত 100,000 অপারেশন করেছি, কিন্তু আমি কিন্তু ইনজেকশন নিতে ভয় পাই। তো আমি যার হার্ট নিয়ে অপারেশন করছি, ইয়ে করছি, চপ চপ, কিন্তু আমি নিজে আমার একটা ছোট্ট রেনাল স্টোন ছিল। আমি যখন কাটিয়ারে 2007 হবে, one evening it started paining, renal colic, and the authority took me to the hospital, and the lady, the young nurse, she came with the injection. I was wait. I'm so much, I fear injection. So I'm telling you just a break, and this is the arterial supply. You have to know the thing. It can be a beautiful, even some tumors. And previously, whole radical mastectomy, lymph node clearance, and all this was the practice. Even some cases, pectoralis major muscle kete dito. But at present, the scenario is changed, and you go for simple lumpectomy. So you just see, you feel, and when you are seeing a lady for breast pathology or breast problem, you have your attendant or the person accompanying, or if you don't have, only she came alone or she came with a husband. So you call any lady in the chamber, Didi, ekটু দাঁড়াবেন, দাঁড়ালো। You just remove, একটু ধরো শাড়ি পিন আছে, দাঁতের কাছে শাড়িটা লাগালো, আঁচলটা লাগালো, দিয়ে এমনি পারবো না, ওইভাবে হবে না, তোমাকে খুলে দেখাতে হবে। তারপরে you make us sit in the sit, and then you palpate the breast and see. First, you ask her to locate where she is feeling the problem. She locates it. You take a marker pen or a dot pen and you mark that position. And then see, if she is complaining of the right breast, then go to the left breast. First, see the normal breast. You palpate. And then you might find some pathological problem, but she is not aware or not complaining of. So then go to the side which she is complaining of. Then you mark. Now you do one of the greatest tools and the cheapest tools, that is ultrasonography with colored Doppler study and fine needle aspiration cytology. This is the series of tests. You go for your thyroid profile, prolactin, and routine blood sugar, CBC, whatever it is. Now, venous drainage of the mammary gland. Now, you see, this is the internal vertebral plexus, and this is the azygos vein, posterior intercostal vein, internal thoracic vein, and this is circular venous, this is the axillary vein. Now, if any pathological tumor is there which is malignant, that means even a lady, she has undergone an operation for lumpectomy and it came out with a result of malignancy. Radiation, what is the oncologist? You send it to oncologist, but she's okay for 5 years, 10 years. Suddenly one day she says, the Dr. Babu, আমার এই কোমরটা যেন কিরকম হয়ে গেছে। She has encountered a vertebral fracture. Now, that you immediately what you have to do is that, now it is significance that the drainage is going, the venous drainage, it's carrying this thing. The vertebra, spinal column is most affected, the lungs affected, because see, after your breast surgery, before breast surgery, you do the ultrasound of the breasts, you do an X-ray or radiological of the chest, and you do a USG of the abdomen, because see, now the diaphragm, now this is the liver, this is the uterus. So that can come down like this, precipitate. Now, so this should be kept in mind. Ekbare breast মানে nipple, areolar tissue and your breast tissue. No, you have to think in this mode. Well, what are the possibilities of future spread? What are the possibilities of your diagnosis? And a vertebral spread যখন হয়, এখন তো PET scan, অনেক কিছু হচ্ছে, MRI, everything is there to locate everything. But when she gets a fracture there, you cannot do spine surgery. So you have to give a palliative treatment to explain, tell everything, whatever it is, belt, okay. Now, now lymphatics from the parenchyma of the breast. See, parasternal, sternum, parasternal, parallel to the sternum. Okay. Now, apical group, the breast and the axillary, the apical group. Now, you can see the anterior group. Axillary nodes 75%. That's why when you ever you examine the breast, then you definitely palpate the axilla to find if there is any lymph node are there. But she might have had a small abscess or something that might be enlarged. But you locate, draw a figure and say palpable lymph nodes are not absent or lymph node not palpable. And you are not saying their name. ये नहीं हो सकता है. Lymph nodes are there, but it might be an inflammatory or non-specific reactive lymphadenitis. There's no specific diagnosis of exactly what disease. It can be inflammatory, it can be your malignancy. So you have to differentiate and always keep in mind, see each slide can be a short note. What is the arterial supply of breast? Each slide, we see the whatever, I don't know what is the number of slides I have, but each slide, it can be a 5 marks, 2 marks question. Or the total, it can be a 15 marks question. Another 5 marks, some other can be added. Now, lymphatics from the overlying skin of the mammary gland. Now, lymphatics of the overlying skin of the infraclavicular nodes, supraclavicular nodes, parasternal nodes, the subperitoneal lymph plexus, this is rectus sheath, this is the hepatic nodes, the ovary that I drawn. It can precipitate. Okay. Now, this is the milk line, mammary streak, it is called. See, mammary streak, the fetus, at this mammary ridge, there's a mammary ridge in this mammary streak, accessory mammary glands and nipple, this is the accessory mammary. Edokum, you can see. So, the first slide I told you, তোমাদের একটু চমকে দেওয়ার মতো, কি দেখলাম, কি দেখছি? The artist who drew, he had some anatomical knowledge, or he didn't have any anatomy. That, of course, every artist must know anatomy. Those are interested. আমার 4-5টা বই বলে দেবো, তার মধ্যে 3টে তোমাদের পড়ার কথা ছিল আগের দিন, আমি বলিনি, বলতে পারিনি। তো এটা একটা অ্যাড হবে যে it's a small book, it's a very fantastic book, you might get it in Amazon or anything, you purchase for your this thing, seeing how to draw. Now, triple assessment. See, clinical, age, examination, confident diagnosis in 99% of cases. Now, imaging, USS, USD, mammography, FLAC, and your core biopsy. Now, this is the pathological FLAC and core biopsy and triple assessment of breast symptoms. Triple assessment, you need the clinical knowledge, you have to have an imaging, but mammography. Now, previously mammography was through an X-ray, they do it. But now, digital or CT mammography, you will get especially the diagnosis of ductal carcinoma. A lady aged 60 years, or menopausal lady, 45 years, or it can be even menstruating lady, that she comes with a complaint of blood and some discharge from the nipple, and there is some feeling, a different feel. You have to feel. I'm telling you, you have to practice. To me, at a normal feel karo, and you feel the normal. She's complaining of the right breast, and you feel the left breast first, and then you go for the site of complaint. Site of complaint. Here, see right and left. Now, example of accessory breast tissue and mediolateral oblique mammographic views of the breast demonstrating asymmetric tissue in the right axilla arrow. This is the tissue. Now, overlying the pectoralis muscle. Overlying the pectoralis muscle. Now, corresponding targeted ultrasound of the right axilla shows benign tissue consists with accessory breast tissue polymachia. This is known as polymachia. Embryologically, this is a result of incomplete regression of the right mammary ridge at this location. The mammary ridge যেটা embryologically আছে সেটা regression হয়নি। এই তো ভাঙা গড়ার খেলা। ধরো গাট বেরিয়ে আসছে, স্টামাক বাঁ দিকে আছে, স্টামাকটা রোটেশন হচ্ছে, ডান দিকে চলে এলো, এই যে খেলা চলে, তো সেই খেলাতে এটা একটা, now you see this is the sternum, this is muscles, this is the deep layers of the superficial fascia and epidermis, dermis, subcutaneous tissue, corpus mammae, subglandular space, deep layer of superficial fascia. This you will be dissecting and seeing in the thorax, and anterior lamella, posterior lamella, deep fascia, pectoralis major. Now superficial fascia, campus fascia, and superficial fascia, scarpus fascia. Now to see this, the arrows over here, this is a mammography. Now total two facial layers are present, superficial and deep layers of the superficial fascia, which surround the breast parenchyma. The fascia called septa called Cooper's ligament. Now this is Cooper's ligament. Note that can be a small short note or MCQ. Okay, Cooper's ligament. Now, which attach to the breast to the skin anteriorly and to the fascia of the pectoralis major deep fascia posteriorly. They also run through the breast, providing a supportive framework between the two facial layers. If there is a malignant tumor which causes infiltration and shortening of the Cooper's ligament, there will be a dimpling of the skin on the physical examination. B. Mediolateral oblique mammographic view shows Cooper's ligament. These are the Cooper ligament here. Now, which attach to the superficial layer of the superficial fascia to the skin, also shown in the retromammary or submammary bursa or space white arrow. Now, which contains loose connective tissue and additional Cooper's ligament that attach the breast to the chest wall. That's why always actually when you a patient lady with a complaint, আমাদের দেশে এক ব্যাপারটা কি হচ্ছে, ব্রা পরার ব্যাপারটা খুব একটা থাকে না। তো occasionally a lady wears, but when she is coming to you with any complaint of the breast, you advise her to have a good fitting bra. Even the lactational bras are available in the market. If you see if she's having a complaint, big breast, she cannot manage, then you it has a zip or button with so she can breastfeed. So these are the small things that counts, that reflects. because she will feel better on your next visit. ধরো তুমি ডেলি 20টা রোগী দেখো, সেখানে তো প্রত্যেকজন তো ব্রেস্ট প্রবলেম নিয়ে আসছে না। একজন তুমি শুনলে, তুমি জ্বর দেখলে, প্রেশার দেখলে, হ্যাঁ মাসিমা ঠিক আছে, কোনো চিন্তা করবেন না, একটা ব্লাড টেস্ট করে একটা ফটো করালে। কিন্তু যখন একটা ফিমেল উইথ দিস টাইপ অফ কমপ্লেন শি কাম, ইউ টেক্স জাস্ট 5 minutes, ম্যাক্সিমাম 5 minutes মানে অনেক। এই কাউন্সিলিংটা হচ্ছে মেন। ইট ইজ নট দি ইঞ্জেকশন, অ্যান্টিবায়োটিক আর হায়েস্ট ডোজে অ্যান্টিবায়োটিক, মিসইউজ অফ অ্যান্টিবায়োটিক, মিসইউজ অফ অ্যানালজেসিক। ওকে, দিস শুড বি স্টপড। অ্যান্ড ইউ, কারণ এখন তো একটা ইউনিভার্সাল ড্রেস হয়েছে ওমেনদের, যেটা হচ্ছে সালোয়ার কামিজ আর ম্যাক্সি। সে তুমি ক্ষেত খামার গ্রাম গ্লোবালাইজেশনের জন্য একটা, আমার কিন্তু খুব ভালো লাগে যে গ্রামের ছেলেমেয়েরা একটা অন্য অ্যাটিটিউড নিয়ে চলছে। আগে যেমন কলকাতায় রেস্ট্রিক্টেড হতো, সে পলিটিক্যাল নেতা তৈরি হবে কলকাতায়, কলকাতার বাবুরা যা বলবে তাই শুনবো। কিন্তু এখন তোমার ফোনের দৌলতে কিন্তু গ্রামীণ ভারত এলিভেটেড হয়ে গেছে। So your perspective and outlook should change in every part of your education in anatomy, physiology, biochemistry, whatever it is, medicine. You see, you have this component in it. প্রথম দিনই তুমি সিটি ম্যামোগ্রাফি করাবে না। এই প্যালিয়েটিভ ট্রিটমেন্ট গুলো, সাপোর্ট, এগুলো তো বলবে। তার সঙ্গে সঙ্গে ফার্স্ট লাইন, যেমন a patient comes, the party asks me যে ডাক্তারবাবু কি করব, কি করলে ভালো হয়, তখন আমি বলি এটা সিভিক পুলিশ দিয়ে হয়ে যাবে, মিলিটারি নামাতে হবে না। কিন্তু যখন তুমি দেখবে ইউ উইল গেজ দ্যাট না এরকম একটা লিম্ফ নোড আছে, এখানে ডিম্পলিং অফ দি স্কিন আছে, কুপার্স লিগামেন্টে টার্ন করছে, your mind will go this thing that it go in the line of investigation, in total investigation, কার পয়সা আছে না আছে দেখে লাভ নেই, and refer. But before referral you have your document, you take that document, goes to New York, London, you be proud that no fear, I've given the prescription, they can go anywhere. বুঝতে পারলাম তো? একটা কথা হচ্ছে এখানে তো এই ইমেজরিটা, now invasive ductal carcinoma, invasive ductal carcinoma in a 45-year-old woman with a lump in the left breast for 6 months. A digital mammogram clearly shows an oval shape, relatively well circumcised. This is primary mass. B. Breast tomosynthesis image provides better depiction of the microlobulate speculated border of the mass arrow. This is and a finding suggestive of malignancy. So with imaging you can do, if you want to know what type of malignancy it is, you go for a FNAC, but if that does not suffice, then go for the trocar and take a small bit of tissue. You need not cut the breast to give the breast tissue for this thing. You can go. Now you see what I told you, this is the accessory nipple with congenital retraction of normal nipple. This is what? And this is here. Now, recent nipple retraction, slit-like retraction of the duct ectasia with mammary duct fistula, circumferential retraction of the underlying carcinoma. This. একটু দেখবে এটা we are dark skin. Asians are dark skin. কিন্তু ইউরোপিয়ান লেডি অর এনি লেডি অফ যারা ফর্সা তো তাদের যখন দেখবে একটা লাল মানে অরেঞ্জের মতন একটা কালারটা স্কিন compared to the, say if the pathological breast is the right breast, then the left breast will show you, you will view that it is different. And the Cooper's ligament, it's a turn down. Like a hammock. এখান থেকে ওখান থেকে টেনে রেখেছে তো now bilateral accessory breast এই যে accessory breast যেটা বলছিলাম benign breast disease bilateral accessory breast it's taken from Benign Lab. It's from Saudi Arabia. Previous picture was Dr. Goel, India. Now congenital absence of right breast. Now this is the congenital absence of right breast. The nipple is there, everything. আর অত এমন একটা চেঞ্জ হয়েছে যে এবার how would you manage this? How would you manage this? একটা ভদ্রমহিলা এলো বললো দেখুন আমার ডান দিকের স্তনটা ঠিক আছে বাঁ দিকেরটা ঠিক নেই So I told you in your first thing that breasts are the weapon, best weapon for of the woman. So একটা breast নিয়ে যাবে শাড়ি পরুক যাই ড্রেস পরুক she feels embarrassed. তো এখন প্যাডেড ব্রা বেরিয়েছে অনেক কিছু বেরিয়েছে কিন্তু that is not a permanent solution. But no thing that can be a safe alternative and cheap. তুমি বলে না দেখো তুমি এত চিন্তা করো না তোমার বাচ্চা হবে সবই হবে মায়ের দুধ খাওয়াবে তার সঙ্গে তোমাকে একটু কৌটোর দুধ খাওয়াতে হবে Now you can tell if she is anxious when she comes a mother then what will be to this breast So you tell her need not worry this right breast will be functioning but this is not there okay if you are feeling embarrassed then you wear a bra padded bra. Okay. Now, one thing is that, another thing is that you can do a silicone implant. A silicone implant, small sizes according to the measurement you order, and that will be made tailored accordingly, and you send it. They'll send it to you, any company. So that breast you make a slit under the skin you put it. But it has some, say every procedure has some advantages, disadvantages. So it might be after 15 years, 10 years, she might be having some discomfort. So again you might have to replace, take it out and replace. So these are the possibilities. Now, now this is the papilloma of the nipple. This is Professor Deshmukh from Nagpur. He clicked the picture. This is the papilloma of the nipple. What you have to do is that you do surgery. এমনি করে দিয়েছে মানে এমনি করে কেটে দিলে হবে না It's an art. You have to be a skilled. This is a physician or a surgeon. He should be an artist. Artist in thinking. You might not become a Kala Bhavan artist or Calcutta Art College artist, but at least একটা ভালো যেন দেখতে হয়। একটা ব্যান্ডেজ মাথা ফেটেছে, বেঁধে দে তো, বেঁধে দে তো। একটু সুন্দর করে তোমার অ্যাসিস্ট্যান্টকে শিখিয়ে দিলে যে এইভাবে বাঁধতে হয়, এইভাবে করতে হয়, সে ওয়ার্কলোডটা নেই। কিন্তু বেরোবার আগে যেন তুমি একবার ফাঁকে দেখে নিলে, ঠিক আছে, হ্যাঁ ঠিক আছে। সো ইউ হ্যাভ টু মেক ইট আ হ্যাবিট। হ্যাঁ, আমরা অ্যানাটমি পড়তে এসেছি, এগুলো কি বলছে স্যার, কিন্তু তোমাদের বলছি, আমার কথা বলবো। তো inflammatory carcinoma of the right breast, this is the presentation. See this intramammary breast abscess. Now what happens, a lactating mother at 3 months of after the childbirth, she might come and complain, this is a swelling, it is hard, and see it is paining, and tumor হয়ে গেছে. So what you have to do is that you do an imaging, and FNC, it will be a galactoscene. Now child of 3 months, তুমি একটা বড় সার্জারি করতে যাবে না, তুমি তাকে কাউন্সেলিং করবে, মাকে কাউন্সেলিং করবে যে তুমি এখন ব্রেস্ট ফিড করো, বাচ্চাটা একটু বড় হোক, 6 মাস হোক, let the child grow up 6 months, and then you think, there are some drugs, you can stop lactation. You have to, lactation must be stopped. If you go after 6 months surgery, then you can plan like that. According to the situation, then you have to plan, and then there are some drugs you have to tell her to take, then slowly that will wane out, and lactation will stop. Because at this stage of lactating breast, if it is operated for any pathology, there will be a milk fistula. You see the glands, so many glands are there. Now it becomes constant, your milk comes out from that sinus or the wound area. So that becomes another blunder. And one thing is that, so you have to handle any breast pathology in this approach. Now, extensive intramammary abscess. This is from T.A. Butcher and Hayes, Dublin. It's from Bailey and Love, these pictures. Now, tuberculosis of the breast with secondary supporting axillary lymph nodes, courtesy Professor A.K. Tafuk, Lahore, Pakistan. Now, see, a lady, because tuberculosis is very common in our country, but slowly, due to awareness, due to government programs, the thing has decreasing. If any person with a gland, think of tuberculosis first. A young lady or young boy with cervical lymphadenopathy. And in this type of case, then you see when the patient is come, if you see that the right is big, pendulous breast, but the left breast is normal, then you ask her to undress. If she doesn't complain, then to even say, Didi or Ma, এটা দেখাও তো, তোমার মনে হচ্ছে যেন একটা ছোট বড় আছে, I think the two are not of the same size, it's asymmetrical. So, and look for the armpit, and you just tell her to hold it like this, then you put your hand and palpate the anterior group, posterior group, medial group, lateral group. All these are in the books. But your thinking has to be focused in this way. Now see, subareolar abscess in duct ectasia. Duct ectasia. Yeah. Mammary fistula originating in chronic subareolar abscess. Now, bilateral duct ectasia with fistula, bilateral. So this type of fistula and the abscess, you have to do excision from depth. Okay. Now, this is the galactocele, which I told you earlier, the lactating mother. That thing has become a big encapsulated sol, space occupying lesion. So you draw and then write sol for FNAC. See, this is a phyllodes tumor. Tumor is a woman aged 28 years. It weighed 4.9 kgs. Note the ulceration between the skin and the tumor. Not so in carcinoma of the breast. Actually, phyllodes become a big tumor. And you can operate, remove. And see, it is different. If this was a malignancy, see this picture of phyllodes it is a non-malignant condition. Okay. Now, this is a malignant fungating breast tumor. Enormous fungating carcinoma of the right breast with enlarged axillary lymph nodes. Here and Thakur, Patna, India. This is now lymphangiosarcoma developed 3 years after radical mastectomy. Patient many years after a quarter amputation, RP Singh, Kachana. Actually, when there is lymph node clearance and all, then sometimes you see after the operation, she's undergoing chemo or still she has a lymphadenoma. But it matter not, the bone is not affected. I am dressing a wound for the last 3 days. In my clinic with a breast carcinoma, but she presented with us lymphedema and fungating breast carcinoma. We are dressing with honey. Now see the implants, selection of external breast prosthesis. This is breast prosthesis. Now these are the different types of operation, tram flap and all this. And see carcinoma of the male breast. Now even male has a breast. So that is the carcinoma of the male breast. Okay. And advanced carcinoma of the male breast. See the advanced carcinoma. This is the axilla. This is from England. Don't think you don't think India te hoy, আমাদের দেশে হয়, ওদের দেশেও অশিক্ষিত লোক আছে, ওদের দেশের গ্রামের লোক আছে। Village will stay. যতই তোমার ড্রোনে যতই যা করুন, সে ম্যারেজ ফটোগ্রাফি টু your fertilizer spray in the fields. So medical aid, I told you the very first day, does not, it is equally blunderous. I told you New York City is having ghettos. You go to Google and see ghettos. What are the ghettos? আমাদের কলকাতা বা এই যে আশেপাশে বস্তি তিরপল সাজানো আছে, shelter. It will remain. Elon Musk is there or Bill Gates is there. Now, this is the Chief Chengwa from a photograph of this is a African chief of a tribe. You will find this photograph in Old Bailey and Love. Now, the other day I showed you this slide. Now, thank you. Please go to practicals. My batch, not my batch, whatever it is, anatomy, whatever batch is there, I'll be taking a practical there. Please sit in the demonstration room, I'll reach. Practicals hobe, anatomy te practicals hobe, onno department er kotha bolte parchi na. So you come for practicals. Because your thorax will start, you must know whatever it is there, I will show you. Thank you.